What is urinary incontinence?
So there's two forms of urinary incontinence. Again, the word incontinence simply means you lose urine. You can't hold the urine inside your bladder. And there's two forms that we identify for most women. One is called stress urinary incontinence, and then the other one is called urge incontinence. Now, the crazy thing about urinary incontinence is it is so underdiagnosed and so undertreated for women in this world. 2 out of 3 women in this world that have had vaginal deliveries have some degree of urinary incontinence. So again, let's address these two. Stress incontinence is what occurs when you cough, when you sneeze, when you jump, when you run, you lose your urine. That is stress incontinence. Many women think they don't suffer from stress incontinence, but if you ask those specific questions, do you lose urine when you cough? Do you lose urine when you sneeze? Do you lose urine when you jump up and down? You have stress incontinence. And we have a management plan for that. The other form of incontinence is called urge incontinence. That's when the bladder has a spasm. You're not doing anything. You may be sitting on a couch and you lose urine.
So what is our treatment option?
So management of stress incontinence historically has been surgery. We think we have a better treatment plan. And there's ongoing studies that this procedure is very beneficial for women, and it's called the O shot. Interesting about this O shot, this was created by an internist over 10 years ago. He's educated thousands of providers, both physicians and nurse practitioners around the world for his procedure. And what it involves is taking a tiny little needle and injecting platelet-rich plasma back into your body. I want to explain platelet-rich plasma. When you take blood out of your arm and spin that blood down, so we put it in a machine, spin it around, the blood separates basically into 3 different categories, and you can see it in the tube. One is the red blood cells that go to the bottom. In the middle, there's platelets. Platelets are the things that cause your blood to clot. So I'm shaving, I cut myself. If I don't do anything, I'll see a scab here over the next 5 to 10 minutes. That scab occurs because of your platelets. The third thing that you see in the blood is serum. That's the watery part of your blood. So what we do in platelet-rich plasma reinjection is we take the top part, the watery part, and then the middle part, which is the platelets, and we inject it back into your body. Now, it's interesting. This is not new technology. Platelet-rich plasma has been used in many specialties for the past 20, maybe even 30 years. They use it in people that have scarring, whether it's on your face or around your body. We inject it into that scar, and it helps improve the scar. We use it in orthopedics, people that have bad knees or bad shoulders. We can inject it in the joints, and it benefits people. They use it in oral surgery. So we in gynecology over the past decade have started using platelet-rich plasma, PRP injections, for the benefit of stress incontinence and decreased libido. Now, how does this work? It's very, very interesting. So again, we remove your own blood, we separate it out, we take the plasma and we take the serum. Specifically, we're taking the platelets and re-injecting them into your body. So it's your body that we're re-injecting back into your body. So it's completely safe. As far as we know, 0 risk for rejection. So if you look at a woman's body, there's 3 holes. There's your P-tube. Right below your P-tube is your vagina. And right below your vagina is your rectum. And so what we do with the O shot, right near the top hole, which is your P-tube hole, we take a needle and inject on either side of the urethra. We put numbing cream on the area, and then we let it sit for 15 minutes as we're spinning down your blood. After it's sat for 15 minutes, we take ice and put on this area for about 90 seconds. We take the ice off and we inject in two very specific locations. Platelets go back into your body. It signals your bone marrow to create new blood vessels, new tissue in the area that we've just injected. So this new tissue then has new blood vessels being created over the next several weeks and several months after injection. That new tissue then allows potentially the treatment of your stress incontinence. The other benefit of it is it may benefit sex drive. How long before you notice improvement of the stress incontinence and or improvement of the sex drive? Anywhere from immediate to 4 to 6 weeks down the line. So you may get the injection and notice improvement the first day. However, some people may get the injection and may not notice improvement for 6 weeks.
Is this something that is FDA approved?
It's important to understand that the FDA does not approve the procedure or disprove it. They don't make any comments on that procedure. The kits that we use for the O-shot, though, are FDA approved. In those kits, they have an agent that activates your platelets before we inject it back into your body.
Can anyone administer the O-shot?
No. You have to be trained. Just like I'm a surgeon, I can do surgery because I've taken the appropriate training. The O-shot is exactly the same way. You have to be trained. The agency that trains us certifies us.
You mentioned that other providers use PRP in different parts of the body. Do we provide PRP in other places?
Yes, we are going to provide other PRP treatments in the body. One of our exciting things is we will provide platelet-rich plasma to the face, and we will have future videos on this as we move forward.
And is this something that's covered by insurance?
Typically, insurance companies do not cover this. But I talk to patients all the time about this. If you feel horrible, if you are losing urine every time you cough, you sneeze, you walk, you run, do you want to deal with that moving forward? You go to the grocery store, all you have to do is look down the aisle as you're going down the aisle, and there is so many pads for women. And so the question is, do you want to live that way? Or do you want to take control of this, do a procedure that probably will benefit you? Do I end up paying cash for that? You might, but you have to decide as a patient, is it worth it?
And what if our patients don't see any benefit after their first injection?
We will never sit and say this procedure will benefit you 100%. That would be disingenuous. We think it will. There's a large amount of literature that supports that the O-shot is beneficial. It's been around for over 10 years. 49,000 plus people, be it nurse practitioners or physicians around the world in 50 different countries, have been trained on the O-shot, and they're giving it to their patients. We are confident that the O-shot will benefit you, but it may not benefit everybody. So our policy is, if it does not benefit you, we would like to re-inject you and see if the second injection will benefit you. If it does not, then we would like to give you your money back. No questions asked.
Sounds great. So if you would like to book an appointment for a consultation on the O-shot, or if you would like to book your O-shot now, go ahead and click the button and we'll see you soon.